New at 6, a major holdup in healthcare. It's been a year since North Carolina revamped its Medicaid program, turning it over to 5 private companies to handle, but some smaller healthcare businesses are still waiting to get paid.
That's right. In fact, one Concord business alone is waiting on $80,000 worth of claims. And so as that owner asks, where's the money? A top state official told our Nate Morabito that he takes personal responsibility for the failure.
North Carolina had years to prepare for the Medicaid change that took effect last summer. But the companies now in charge bear some responsibility too. And we've learned the state fined some of them big money for falling short on promises.
I can't run a business like this.
Corey Peña is a man of faith.
I'm just like, God, help me.
But the rollout of North Carolina's Medicaid managed care program,
we owe $144,000,
has shaken his trust in the government.
We were getting ready to sell our house
And left his pediatric orthotics business on the brink of bankruptcy.
It's kind of like I'm successful, but I'm closing my business. That's devastating.
In November, WCNC Charlotte first documented Peña's challenges with the transition.
It allows him to do this.
And issues with several of the prepaid health plans, or PHPs, that manage the program. But instead of things improving,
Oh, we'll fix it.
Peña says his unpaid claims have grown to $83,000,
That's what all these PHPs owe us.
forcing him to spend most of his time troubleshooting rather than helping his patients.
It's unfair.
State records show the Medicaid ombudsman's received an especially high number of complaints in recent months, more than a third of those tied to claims and reimbursements. Meanwhile, data reveal the 5 companies running the program are denying a little more than 1 out of every 4 claims.
I think we're seeing a higher denial rate than we want.
Dave Richard is Medicaid's deputy secretary.
The numbers that we're seeing, although concerning, they're very small numbers still.
He says the program overall is serving the needs of low-income and vulnerable patients and largely reimbursing medical providers in a timely fashion. But he's also aware the program's repeatedly failing some small business owners like Corey Peña.
We thought it had been corrected. My fault for not digging deeper in that point to make sure that it had been.
To be out $83,000 a year in is ridiculous.
It is. Again, I will say this: no excuse. We did everything right, and we just did not. We did not deliver, and that's again on me. It's on our team. It's on our health plans, and we'll get better at doing this.
As an extra incentive, the state is penalizing the health plans when they don't live up to their end of the bargain. Richard says he's made it clear to those companies they need to focus on getting it right for smaller providers like Peña.
We hate what happened to this one provider. We think in general the program is going well. We think it will continue to improve, but we can't have providers put in this position.
As the program improves, so does Peña's outlook.
This is a miracle of God.
It took him begging for help, but he finally feels heard.
I believe and trust that this situation is going to turn around. It hasn't happened quite yet, but I'm not selling my house.
Now full of hope, he's putting his faith back into the same program he says nearly cost him his dream. Great news. He expects to get a check for about $37,000 from one of the companies as soon as this week. Nate Morabito, WCNC Charlotte.
And the North Carolina Association of Health Plans maintains the Medicaid transition has been among the smoothest in the nation. Still, in a statement, the association told us in part, health plans are working diligently to address individual provider issues and identify solutions. And right now on our website and mobile app, we have several graphs and tables related to this story, including a breakdown of the fines these 5 companies running the Medicaid program have paid or had to pay because of these holdups. Just click on Nate's story on the homepage to check it out.